I'm Dr. Anjum Bux. We're going to be demonstrating a continuous femoral nerve block using the OnQ T-Block system and LifeTech products. We have a LifeTech EasyStim 2 nerve stimulator. I'm going to go ahead and connect the electrode. Turn it on. Usually we do this with nerve stimulation and ultrasound, and usually I start out at 1 milliamp. The LifeTech products we have here, it's an 18 gauge 2E 50 millimeter needle with the connection for the nerve stimulator and the catheter for the local anesthetic. There is a catheter, 21 gauge catheter with this, with a connector. The T-Block system has the ultrasound probe with rubber bands. We have some gauze with this system and a drape with adhesive around a smaller aperture for your sterile site. Also with this is a Locket Plus catheter securement device to secure the catheter. There's some local anesthetic in this, about 5 mL of 1% lidocaine. There's also 3 mL ChloraPrep, orange tinted. There's some ultrasound gel and 25 gauge needle and an 18 gauge needle. So those are the things that we will be using to perform our block today. I'm going to go ahead and prep the site with the 3 mLs of the ChloraPrep. We'll use our drape to create a sterile field. I have the ultrasound probe cover. I have already placed some non-sterile gel on the ultrasound probe. There we go. Pull that. Put a rubber band around that. Okay, I'm going to leave my probe right here while I drop my local. I will connect my LifeTech needle to the nerve stimulator using the black connector. I'll also connect it up to my local anesthetic. We'll flush that. Place some gel on the ultrasound probe. We'll confirm orientation of the probe, which side is lateral. Place this just inferior to the inguinal ligament. There is a hypoechoic density there, which is pulsatile. That is our femoral artery. We'll put color on to confirm. We'll color off. Go ahead and print that picture. Okay, there's a hyperechoic density just lateral to the femoral artery, and that is our nerve bundle. If we angle our probe, we can see it a little bit easier. Yes. Okay. We're going to do a skin wheel. Can you move that cart just a little bit closer to me, please? We're going to go ahead and do our skin wheel just lateral to the probe. And I do a little big pinch in the burn. I do go in plane so I can view my needle going in. Big pinch here. We are getting our twitch. Turn it down, turn my nerve stimulator down. We're getting the patellar snap that we're looking for. Okay. Now let's inject a little bit of local. Perfect. We inject 5 mLs at a time and continue to aspirate.
10 ml toe. Aspirate.
Okay. And we can see the local anesthetic surrounding that nerve bundle just lateral to the artery.
Aspirate. 25.
Okay.
And the last 5.
Okay. Okay. Disconnect from the syringe, and this catheter is one of the LifeTech products. This is a 21 gauge catheter. This does have markings on it. There is a 10 centimeter marking and each centimeter after that. So we will advance this catheter to where we're about anywhere from 12 to 15 centimeters at the skin. Okay. That's about 13 centimeters at the skin. We'll take one of our 4x4s, wipe off the excess gel. There is some tincture of benzoin provided in the kit. I will use this around the catheter site and around where I'm going to place my catheter Locket Plus securement device. We'll give time for that to dry. There are stereo strips provided in the kit. We'll secure our catheter down with the stereo strips provided. Now we'll go ahead and open up our Locket Plus. There's adhesive on the back end of this. The catheter goes from the back end through the hole in the Locket Plus. We'll pull the catheter through. We want to be about an inch, inch and a half away from the insertion side of the catheter. This will allow us to ultrasound again over the catheter if we need to. Also, we can always check for any redness or leakage of local anesthetic at the catheter insertion point. Pull the adhesive off, place that there. We will close our Locket Plus device and make sure that the catheter is in the groove. Okay, that device is closed. There is a connector with this catheter, which we will place on that catheter. It goes into this hole here. and we turn it clockwise until it's tight. And check our catheter to make sure it's secure. And we're going to take the drape off and pull from the perforation. And our sterile drape comes off very easily. We'll take some more of our 4x4s, wipe off any excess gel. We have tegaderms, which we'll place one over the Lock-It Plus device and the catheter insertion point. And our second tegaderm will be over the coiled catheter, leaving the connector out so it can be connected to the on-cue system. Okay, and there we have it. We've done a continuous femoral nerve block using nerve stimulation and ultrasound with the on-cue T-block system and LifeTech products. Thank you.